Good afternoon, my name is Sierra Chasson. I will be presenting the DOT drug and alcohol signs and symptoms that all supervisors should be aware of in the workplace. First, I'm going to cover the 5 drugs and alcohol that DOT does test for, which include marijuana, cocaine, amphetamines, opioids, phencyclidine, and alcohol. With these drugs, some of them do have subcategories that are also tested for. The first drug we're going to cover is signs of marijuana abuse. With the use of marijuana, you do have multiple indicators, physical, performance, and behavior indicators. Physical indicators consist of bloodshot eyes, increased appetite, dizziness, and dry mouth. Performance indicators consist of slowed reaction, lack of motivation, slow or poor coordination, or impaired coordination. Behavior indicators consist of relaxed state and sleepiness. Also, with the use of marijuana, you do have some side effects, which some do come immediate and also long-term. With immediate side effects, you will see paranoia, elevated heart rate, impaired motor functions, impaired cognition. With long-term side effects, you'll witness mood swings, reduced ability to learn, panic attacks, and memory loss. And now with some states legalizing marijuana, it is a recreational drug. Majority of the users do have the same symptoms as using alcohol. Also with marijuana use and the growth of it, you now have multiple forms of marijuana, which include liquid, wax, or the actual bud and leaf that people smoke. Our next drug is cocaine, which also has indicators, physical, performance, and behavior indicators. Physical consists of dilated pupils, runny nose, and paranoia. Performance indicators consist of irritability, missing or being late for work, and financial problems. Behavior indicators consist of overconfidence, overexcitement, and mood swings. Cocaine is an addictive drug that has short and long-term effects, ranging from overdose to organ failure. Small doses of cocaine can result in effects of happiness, social ability, concentration, decreased need for sleep, while large doses can result in violent behavior, nosebleeds, heart attacks, strokes, and even death. When someone snorts cocaine, it can cause serious damage to the nasal cavity. It is a very addictive drug. The long-term effects of using cocaine does affect your major organs such as your brain, lungs, heart, kidney, and gastrointestinal system. Side effects of using cocaine consist of headaches, high blood pressure, chills, confusion. You'll have trouble sleeping, night sweats. If you do intake too much, it can throw you into a coma. The next drug we're going to talk about is amphetamines. Also have indicators such as physical indicators, not eating, loss of weight. Performance indicators, missing work. Behavior indicators will consist of episodes of violence, visual hallucinations. When taking amphetamines, your body eventually gets used to your dose and the effects start to fade, causing you to need a larger dose to tolerate. Amphetamine dependence can be as scary and life-threatening. With consistent use, it can lead to brain damage systems that resemble Alzheimer's, epilepsy, or a stroke. Withdrawals can consist of depression, anxiety, fatigue, paranoia, aggression, intense cravings. Treatments for abuse of amphetamines will result in hospitalization, therapy, or sometimes medication can help you beat that drug abuse. Our next drug we're going to discuss is opioids. Physical indicators of opioids: you'll see needle marks on the arms. They'll tend to be very itchy at times. It'll sometimes feel like ants or bugs are crawling on them, which makes them look as if they're always scratching. Performance indicators: it's very hard for a person on opioids to stay awake. Behavior indicators consist of dramatic mood swings and impulse actions. Typically, opioids are prescribed as oral capsules. Some usually borrow or steal pills from their family members or friends. When it is a tablet form, sometimes it is crushed into a powder form and then snorted, or the powder can be dissolved in a liquid and injected into their veins. Immediate side effects of opioids consist of a relaxed state of mind, feelings of calmness, slowed and shallowed breathing, nausea, hallucinations. Long-term side effects, especially with using the needle, vein damage, emotional instability, lack of concentration, depression, and insomnia. Some serious risk of using opioids, especially when you are injecting it into your veins: you have the chance of contracting HIV or AIDS. Some women who partake in opioid drugs, it is called a neonatal abstinence syndrome. Some women struggle to get off of the opioid while pregnant. The next drug we will talk about is phencyclidine. It's a hallucination substance that affects the brain. This was first used in the 1950s as an anesthetic. In the 60s and 70s, it became a recreational drug, causing the users to detach and disassociate from their surroundings. It produces a strong feeling of euphoria. After smoking it, you can feel the effects 2 to 5 minutes later. The effects will last up to 30 minutes. If you swallow the pill, you will feel the effects after 30 minutes, and those effects will last 2 to 5 hours. Some of the side effects you will feel is delusions, seizures, chills, paranoia, numbness, dehydration, aggression, or muscle cramps. Phencyclidine is typically smoked, but may be taken by mouth, snorted, or injected. Long-term effects: suicidal thoughts, mania, flashbacks, social isolation. It's also known as angel dust. That's the street name for it. Once you become dependent on PCP, it is very hard and painful to withdraw from your symptoms. The next topic is alcohol abuse. Speech indicators consist of slurred speech, rambling statements. Physical indicators: bloodshot eyes, difficulty standing up. Performance indicators consist of lack of coordination, blank stares. Behavior indicators consist of agitation. Your liver and brain are the most affected by alcohol. Short-term effects from alcohol consist of trouble breathing, impaired judgment, headaches, blackouts, nausea, distorted vision, or hearing. Some long-term effects of alcohol consist of depression, cirrhosis of the liver, high blood pressure, nerve damage, malnutrition, and cancer of the mouth. Alcohol does not always have medical effects. Sometimes it has non-medical effects, which can result in financial issues, relationship issues with your family, friends, or spouse, needing alcohol to relax you, or being unable to control the intake. Hopefully you gained some knowledge from this presentation and can pinpoint any signs or symptoms reflected in the workplace. Understanding the information of these 5 drugs and alcohol can possibly save a life and hopefully save your company one day. All the drugs covered in this presentation can have damaging side effects on the mind and body. For help or treatment specialists, contact 855-706-9275.